Hello everyone, good morning. I want to go ahead and address this question that was brought up by another surgeon who has been in on 15 surgeries in regards to the essence and importance of removal of the capsule, and he had voiced his opinion in being only 15 surgeries that it might actually be detrimental to the body to remove the capsules. I just want to go ahead and emphasize 15 surgeries is not where you can formulate an opinion, and it will be ignorance / even malpractice to give out wrong information. As you will clearly see, the importance and essence and gist of explant surgery is to remove not only the implant but also the capsule, plus all of the capsule in its entirety off of the rib. You hear of some surgeons doing the pulse lavage technique, if you will, or cauterizing the capsule directly on top of the rib. This is incomplete. The entire capsule must be removed, and it must be sent to pathology, and it absolutely can be removed. Yes, in some cases it's easy, and in some cases it can be relatively thin, where the challenge of the surgery certainly becomes the task for the surgeon. And this is where the time it takes to remove the capsule can certainly be long, but the entirety of the capsule must be removed. As you will see in this pathology report, you have implant particles within the capsule. If that capsule was left behind, it will continue to hinder, and with the post-operative recovery would not be optimal, and this is where the patient would continue to hurt and suffer from the many signs and symptoms of breast implant illness. We know of the many patients who have had complete removal of the capsule, and they had resolution of their many signs and symptoms of breast implant illness even after the many years that the implant was removed. Now, this notion that removal of the capsule is going to hurt the body is basically all flawed. So the many patients who undergo facelifts, for example, or the removal of mastectomy, for example, where they have to remove the tissues, the connective tissues, for example, or facelifts, for example, or tummy tucks, or the many other surgeries where you have to do a very rigorous removal because of the cancer that was present. Do you find that these patients have cancer as a result of disruption of the lymphatics? Absolutely not. And so this whole notion is wrong and flawed, and the whole essence of the explant surgery is to remove not only the implant but the capsule plus all inflamed tissue. So just like in this patient, you will see fat necrosis along with inflamed tissue has been removed, and we have to send this off to pathology to make sure there is no lymphoma, there is no squamous cell cancer, or be it the other cancers that are present. Please join me so that you understand the significance and essence of what is explant surgery. This is relatively very detailed, and again, the highlight here is that all of this tissue must be assessed and cancer must be ruled out. This is Dr. Khan, Executive Plastic Surgery.